Hello, I'm Dr. Dawn Harper. Welcome back to the Stay Sure Wellbeing YouTube channel, where today I'd like to talk about preparing to travel if you're taking regular medication. So if you're on regular medicines, you will need to think a little bit ahead. Make sure that you put in any repeat prescription requests well in advance, as it can take 2 or 3 days for surgeries to process those requests. You also want to make sure that they are in stock at your local pharmacy. So order ahead and make sure that you order enough to cover your holiday. I usually recommend taking an extra week or two, so if you should be delayed for any reason, you've got plenty of medication with you. The NHS will issue you a script for 3 months to cover travel, but if you're travelling for longer than that, you'll also need to think ahead of where you will get any repeat medicines that you need. And with that in mind, I always recommend that you travel, and keep this in your hand luggage, travel with a list of your medicines and ask your doctor for both the brand and generic names, because drugs have different names in different countries, and if you've got the generic name, then at least the doctors that you're talking to whilst you're away travelling will know exactly what it is that you're after. Where possible, travel with your medicine in your hand luggage, not in the hold, so that should you be separated from your luggage, you have your medication with you. Make sure that you carry it in its original packaging, so it's clear to everybody what it is. And ask your pharmacist or your doctor before you leave if there are any special requirements for storage of your medicines whilst travelling. If, for example, you normally keep your medication in the fridge, then you may need to consider travelling with a cool bag or a thermos flask, particularly if you are thinking of going to a hot destination. And make sure that all the medication that you have with you will remain in date for the duration of your travel. You don't want to be halfway through that wonderful holiday and realise that your medication is past its expiry date. And a few of your questions. So, can I travel with more than 100 mils if my medication is in liquid form? Yes, you can within reason. So most airlines, it's worth checking with your airline, but most airlines will allow you to travel with more than 100 mils, provided the volumes that you're taking are the kind of amount that you would need to cover your travel, plus a little extra to factor in for any delays. But you may also be required to have a letter from your doctor confirming that you need this medication and what you need it for. You should always carry it in a clear plastic bag, probably separate from other liquids, and be prepared at security control, border control. You may be asked to taste your medication just to prove that it is what you say it is. Can I travel with needles if I need to inject myself on holiday? Yes, you can, but similarly, I would ask your doctor for a letter to confirm that you need this. Probably one of the most common medicines that you would need to administer with a needle would be insulin, and of course, really important in that kind of instance that you carry that with you in your hand luggage, because you want to be absolutely certain that you can take your insulin as you need it, and you don't want to be separated from it if it's in luggage in the hold. But again, that letter is really important, and do remember that your GP might charge a fee for that letter, as it's not routinely covered by NHS services. Can I travel with controlled drugs? Okay, so the first thing to do is to check with your GP or your pharmacist whether any of the medicines that you're taking do come under the controlled drug category. But it's also important that you check with the embassy in the country to which you are travelling, and any country you are travelling through, to check the status in that country. Different countries have different rules with regard to controlled drugs, so you may be fine to leave the UK with a particular drug, but perhaps going through somewhere else you could be pulled over. So if there is any thought that you might be travelling with a controlled drug, it is absolutely essential that you get a letter from your doctor that should have your name on it, explaining what dose and how much of the medicine you are taking, and also have probably the diagnosis, why you're taking it, and be signed by your doctor. Really important that you keep that with you in your hand luggage, and that you can show that documentation to any security or border control that requests it. And finally, what do I do if I'm travelling through different time zones and take my medications regularly? For most medicines, being a few hours out either side is not going to be a big deal. I've spoken about insulin before, and perhaps that's the one that you're going to need to monitor more closely. Keep an eye on your blood sugar levels, perhaps. But generally speaking, and this is quite a good one for jet lag too, is I usually advise for most people that when you get on a plane, you should put your watch to the time of your destination and try to eat and sleep and take your medications according to the new time zone. And that way you will not only be regularly taking your medicines at the time that you're expecting them to wherever you are, but you will also probably find that you get less jet lag. So I hope that helps. Please, as always, let me know what you'd like me to talk about next. I want this to be a really useful place for you to come when you're planning your holidays. So whatever your medical needs, please message me here or drop us an email anonymously, and we'll try to cover whatever you want us to cover. And until then, stay safe and stay well.